Let's talk about the signs and symptoms of a sickle cell crisis. So before I get into that, I want to talk about what sickle cell disease is. Sickle cell disease is a disease of your red blood cells. So instead of having a normal donut-shaped circular red blood cell, you have a sickled red blood cell. I mean, it's kind of like a shape of a crescent moon. This disease predominantly affects black patients, and it actually came about as a way for them to protect themselves against the malaria disease. But a huge adverse effect of all this genetic mutation was that now we have this blood disorder. There are different types of sickle cell disease. There's hemoglobin SS disease, there's hemoglobin SC disease, there's hemoglobin and thalassemia disease. These are all variations of how the hemoglobin in your blood, your red blood cells, are mutated, and they do directly impact what kind of symptoms you might experience. But in general, the most common symptoms all these patients experience are pain crises. As the sickled red blood cells are traveling through your capillaries, once they get stuck, it causes there to be a lack of oxygen in the area, causing all the cells and tissue and healthy muscle to die, and the bones, and that causes you to have extreme pain. So while a pain crisis is obviously very painful, it's not life-threatening. What concerns hematologists the most is preventing any life-threatening tissue breakdown. For example, strokes. If the red sickle cell is going to your brain and it causes capillary blockage there, you could have stroke-like symptoms. If it goes into your pulmonary capillaries and that's where your oxygen exchanges, you could have trouble breathing, and that's called acute chest syndrome. It's actually one of the most common things that we want to rule out when patients come in with shortness of breath in a sickle crisis. The key to every sickle cell patient is prevention. Preventing a crisis from even happening. Staying hydrated, avoiding warm or extremely cold climates. Anything that aggravates your body. You will know as you get older what aggravates your red blood cells. And also as prevention. Medications that can prevent hemoglobin S, the sickling blood, from forming. And we can give you things like hydroxyurea, for example. And then when these patients do get admitted to the hospital, aggressive pain control with high opioids so that they're not longer in pain. These pain crises are extremely painful. Along with it, aggressive IV hydration. You need to hydrate their body to allow the red blood cells to flow properly when they're going through these capillaries. Sickle cell disease is a very elaborate disease that whole hematologists dedicate their whole careers to. So if you have any questions or comments, comment them below because I can't address all of them in a 2-minute video.